Today's ICD-10 quick coding tip focuses on how to select principal diagnosis for obstetric admission with vaginal delivery. My name is Claire and I'm an inpatient coding auditor. In my coding tips and tricks videos, you'll discover valuable insights to help sharpen your medical coding skills and code with confidence. If that sounds like something that would be helpful to you, please consider hitting that subscribe button so that you can be notified whenever I release new content. Selection of principal diagnosis for vaginal delivery has been a frequent area of confusion for coders. Coders often misinterpret the guideline that states in part, when a delivery occurs, the principal diagnosis should correspond to the main circumstances or complication of the delivery by sequencing a condition that arises during the delivery as principal diagnosis, regardless of the reason for admission. Due to this confusion, Coding Clinic published multiple examples of how to select principal diagnosis for vaginal delivery, which I will be covering in this video today. When selecting principal diagnosis for vaginal delivery, there are a few key concepts that are necessary to understand. First is that obstetric cases require codes from Chapter 15, and these Chapter 15 codes take sequencing priority over codes from other chapters. So for an admission where a delivery occurs, the principal diagnosis will always be a Chapter 15 code. Next, it's important to understand that any condition that the patient has, whether it be chronic, pre-existing, or newly developed during the pregnancy, is assumed to be complicating the pregnancy unless the physician specifically states that the condition is not affecting the pregnancy. Now that we have reviewed those important concepts, let's move on to selection of principal diagnosis. First, let's discuss situations where the patient does not have any conditions that are complicating the pregnancy either at the time of admission or developing after admission and delivers a single healthy full-term infant vaginally. In such cases, the principal diagnosis will be 080 Encounter for Full-Term Uncomplicated Delivery. It's important to note that this code is for use as a single diagnosis code and is not to be used with any other diagnosis codes from Chapter 15. Let's look at an example. In this scenario, the patient with no past medical history other than pregnancy is admitted in labor at term and delivers a healthy baby vaginally. There were no complications during the delivery. In this case, the principal diagnosis would be 080 Encounter for Full-Term Uncomplicated Delivery because according to the guidelines, this is the code assigned for a patient who delivers a single full-term healthy infant without any antepartum, delivery, or postpartum complications. Next, let's cover situations where the patient is admitted for a specific condition. This one is pretty straightforward. When the documentation indicates that the patient is being admitted for a specific condition, that condition should be selected as the principal diagnosis as instructed by the guideline. In this example from Coding Clinic, the patient is admitted for induction of labor due to gestational hypertension and experiences a third-degree laceration and a nuchal cord entanglement during delivery. In this scenario, the patient's admission to the hospital was necessitated by the need to induce labor due to gestational hypertension. Therefore, this condition should be assigned as the principal diagnosis because, as the guideline tells us, when a patient is admitted for delivery, the condition that prompted the admission should be reported as the principal diagnosis. A code for any complication of the delivery should be assigned as an additional diagnosis. Next, we have situations where the patient is admitted for no specific reason other than being in labor, but does have chronic pre-existing conditions complicating the pregnancy. For these types of admissions that are simply for delivery following spontaneous onset of labor, any chronic condition complicating the pregnancy should be selected as principal diagnosis over a condition that develops after admission. This is because the patient was admitted for being pregnant and the pregnancy is complicated by those chronic conditions. Next, we have an example from Coding Clinic where the patient is admitted in labor. She has gallstones and anemia on admission, and the physician has not documented that these conditions did not affect the pregnancy. She delivers vaginally but develops atony with hemorrhage after delivery. In this case, because the patient was admitted due to her pregnancy, which is further complicated by the presence of these conditions, either the delivery complicated by gallstones or complicated by anemia may be sequenced as the principal diagnosis. Assign a code for the uterine atony with hemorrhage that developed after admission as an additional diagnosis. Next, we have situations where the patient is admitted for no specific reason other than being in labor and does not have any chronic pre-existing conditions complicating the pregnancy, but during the delivery develops a complication. In cases like these, the principal diagnosis would be the complication that occurred during delivery. This is because the patient was admitted without any complications of the pregnancy and therefore were left with the main circumstance or complication of the delivery as the principal diagnosis. In this example from Coding Clinic, the patient had no complications during pregnancy and is admitted in labor. She delivers a healthy live-born infant. However, the patient experiences a periurethral laceration during delivery that is repaired. In this case, we assign the code for delivery complicated by periurethral tear as the principal diagnosis, even though it was not present on admission, because the periurethral tear is the main circumstance or complication of the delivery. So that's it for today's quick tip. I really hope that this video was helpful for you. If it was, please give it a thumbs up, and if there's any topics that you would like me to cover in the future, just leave a comment below and I'll add them to my list. Thanks for watching, and until next time, happy coding.